Namaste all, welcoming you all to this webinar on PCOD,
Ma'am.
PCOS. Am I audible?
Yes, ma'am.
Okay. So I'm Dr. Preeti. With me, I have Mrs. Neha Bhartwaj and Dr. Amudavarshini. And we will be today speaking on PCOD or PCOS and how we can have a holistic approach to manage PCOD and PCOS with psychological and naturopathy based management. So I represent Prashasti, which is a free medical guidance, mind care and naturopathy initiative of the DAV group in Chennai. So before we move forward, I would request people to tell me if any of you in the chat box, if any of in your family or any known people have PCOD, PCOS. உங்க வீட்ல தெரிஞ்சவங்களோ இல்ல உங்களுக்கு தெரிஞ்சவங்களோ யாருக்காவது இந்த PCOD, PCOSங்கிற பிரச்சனை டயக்னோஸ் பண்ணியிருக்காங்களா? நீங்க அன்மியூட் பண்ணியும் சொல்லலாம், சாட் பாக்ஸ்லயும் போடலாம். You can unmute and tell or put it in the chat box. Yes, no.
Ma'am.
Yes, ma'am.
Ma'am, எனக்கு வந்து ஒரு 6 இயர்ஸா PCOD இருக்கு மேம். இப்ப PCOD வந்து PCOS மாறிடுச்சு மேம்.
ஓகே, உங்களுக்கு என்னென்ன சிம்டம்ஸ் இருக்குன்னு சொல்லலாம். பேசிக்கா என்ன பேசிக் சிம்டம்ஸ் என்னென்ன இருக்குன்னு சொல்ல முடியுமா? மத்தவங்களுக்கு லைக் நீங்க எது ஃபர்ஸ்ட் சிம்டம் இல்லனா எதுக்காக நீங்க டாக்டர் கிட்ட போனீங்கன்னு சொல்லலாமா?
irregular periods மேம்.
ஓகே ஓகே, thank you.
2 months or 3 months once periods வர மாதிரி இருக்கு மேம்.
ஓகே ஓகே ஓகே. சோ
மெடிசன் ஏதாவது போட்டாதான் எனக்கு பீரியட்ஸே வரும், இல்லைன்னா பீரியட்ஸே வராது மேம்.
ஓகே ஓகே, thank you மேம், thank you. So மேம் ஷேர் பண்ண மாதிரி அவங்க சொன்ன மாதிரி PCOD ல ஆரம்பிச்சு PCOS she said it started with PCOD and PCOS. So what is PCOD and PCOS? Are they same? கிடையாது, they are different. So PCOD means polycystic ovarian disease. பேரை வச்சு சொல்லலாம். Polycystic means there will be many cyst means fluid filled cavity. ஒரு 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 ஓட்ட மாதிரி ஒரு விஷயத்துல தண்ணி இல்ல ஒரு fluid fill ஆனா அது பேர் cyst. So ovaries-ல நிறைய cyst இருக்கும். There are many cysts in the ovaries, which is polycystic ovarian disease. It is caused by, we will see the symptoms, when it is only restricted to ovary and its associated mechanisms, it's called polycystic ovary disease. But later, when the entire endocrine system is involved, polycystic ovary disease இருக்கிறது ஒரு endocrine system full body metabolic hormonal imbalance மாறும் போது it becomes a syndrome. Syndrome means it has 2 or more characteristics of disease, 2 or more diseases put together. So in PCOD it occurs when the ovaries produce immature or partially mature eggs which can form cyst over time. So eggs வந்து ஒவ்வொரு menstrual cycleலயும் அது produce ஆகும்போது ஒரு egg தான் mature ஆகும், மத்ததெல்லாம் regress ஆயிடும். Only one egg will mature, the other will regress. But in polycystic ovarian disease, due to hormonal imbalance, those immature follicles will not regress. They will not go down. They persist as cyst. It will again lead to hormonal imbalance. So this is PCOD, which is less severe than PCOS. Polycystic ovary syndrome is a hormone and metabolic disorder that affects not only the ovaries but other systems in the body. So there will be an imbalance of male hormones and there are significant health consequences. So first we are clear that PCOD is different, PCOS is different. So these are the two terminologies. Polycystic ovarian disease it's been like 1 in 10 women. In the meeting, there are 10 women, among us, 1 will have. Okay, that is the level of prevalence of PCOS in the world, and even in India as well. It's actually 1 in 10 to 1 in 15. And it was first described by Stein and Leventhal in 1935. அதுக்கு முன்னாடி இல்லையான்னு கேட்டிங்கன்னா அதை பத்தி we'll see in the previous slides. It was there. So first describe பண்ணது ஒரு polycystic ovarian syndrome னு ஒன்னு இருக்கு அப்படின்னு medical textbooksல பண்ணது வந்து Stein and Leventhal. The prevalence range is 5 to 15 depending on the diagnostic criteria. Polycystic ovarian syndrome னு சொல்றதுக்கு there must be at least 2 of the following 3 criteria. One is chronic anovulation, which means ஓவரியிலேருந்து எக் ஓவம் வந்து ரிலீஸ் ஆகாம இருக்கிறது. there is no ovum released from the ovary. Chronic, it should be more than 6 months or 3 months. There are different diagnostic criteria. Chronic anovulation, hyperandrogenism, which means male sex hormones அதிகமா இருக்கிறது. So that there is high level of male sex hormones, either clinical, which means you can see it clinically, or biological in terms of biochemical test, and polycystic ovaries. If two or at least two of the three criteria are fulfilled, then we call it PCOS. But if it's only polycystic ovaries, then it is PCOD. So it's actually a diagnosis of exclusion, and many other clinical features of PCOS actually overlap with other diseases like thyroid disease. The hypothyroidism, thyroid levels low இருக்கும்போதும் இந்த condition இந்த மாதிரியே similar symptoms இருக்கும். So their doctors will be doing a lot of tests and then only finding. Hyperprolactinemia, when the prolactin levels are high, that may also mimic polycystic ovarian syndrome, and adrenal hyperplasia. So there are other conditions. So it's very difficult to diagnose also, but the doctors use exclusion criteria, the inclusion criteria அதெல்லாம் பார்த்து diagnose பண்ணுவாங்க. But the problem is earlier it is diagnosed and earlier the patient implements lifestyle intervention. In the whole webinar ஓட concept அதுதான். PCOS, to manage it, to keep it under control, lifestyle interventions, dietary and stress management is very, very critical for improvement of features and PCOS and quality of life. Yeah, why it's okay PCOS இருந்துட்டு போகுது, it's okay, let it not only fertility is affected. No, infertility is one problem, but it has other comorbidities like metabolic syndrome, which means diabetes, liver disease like fatty liver disease, obesity, impaired glucose tolerance, type 2 diabetes mellitus, increased risk of heart diseases, psychiatric disorders including depression, obstructive sleep apnea, endometrial cancer, non-alcoholic fatty liver disease. இது எல்லாமே the multiple comorbidities are usually seen in women with PCOS. இவ்ளோ comorbidities இருக்கிறதுனால தான் PCOSக்கு இவ்ளோ இம்பார்ட்டன்ஸ் தரும். இது எல்லாத்துக்குமே பேசிக் லைஃப் ஸ்டைல் இன்டர்வென்ஷனும் நமக்கு ஸ்ட்ரெஸ் மேனேஜ்மெண்ட்டும் தான். ஹவுங்கிறத we will see. So why it is caused? Though it actually the factor is still not very well known, இன்னும் exact cause தெரியாது, but major genetic. So PCOS generally runs in families. அம்மாக்கு இருந்ததுன்னா பொண்ணுக்கு இருக்கிற சான்ஸ் ரொம்ப அதிகம். So genetics has been a long focus of PCOS research. Genetic clusters கண்டுபிடிச்சிருக்காங்க. அதாவது இந்தந்த genes இருந்ததுன்னா, like some people may have insulin resistance genes. அவங்களுக்கு இருந்ததுன்னா அவங்களுக்கு ஏற்கனவே பாடி மாஸ் இண்டெக்ஸ் ஹையா இருக்கும், அவங்களுக்கு PCOS வரதுக்கான சான்ஸ் அதிகம். சில பேருக்கு வந்து ஏஜ் ஆஃப் ஃபர்ஸ்ட் மென்ஸ்ட்ரேஷன், அவங்க ஏஜ் அட்டென்ட் பண்றது வந்து ஒரு ஹையர் ஏஜ்ல அட்டென்ட் பண்ணாங்கன்னா அந்த குரூப் ஆஃப் ஜெனட்டிக் பீப்புளுக்கும் PCOS வரதுக்கான ரிஸ்க் இருக்குன்னு சொல்லியிருக்காங்க. சில பேருக்கு இன்ஃப்ளமேட்டரி டிக்ரீஸ் பிளட் மார்க்கர்ஸ், எல்லாத்தையும் இந்த பிளேட்லெட்ஸ் எல்லா பிளட் கவுண்ட்ஸும் கிரானிக்கா அவங்களுக்கு டிக்ரீஸ்டா இருந்திருக்கு. And another thing is triglyceride levels and metabolic hormone levels increase ஆகிற ஒரு ஜெனட்டிக் குரூப்புக்கும் இதெல்லாம் இருக்கு. ஸோ இதெல்லாம் இருக்கிற ஜெனட்டிக் கிளஸ்டர்ஸ், இந்த ஜீன்ஸ் இருக்கிற பீப்புளுக்கு when the environment and stress is also high, it results in PCOD or even PCOS directly. So okay, and in the offspring, when the mother is pregnant, when there is increased level of androgen hormones, male sex hormones usually increased தான் இருக்கும் pregnancy போது, whether they are carrying a male baby or female baby, because that is needed for the pregnancy to sustain. But when there is maternal stress and when there is increased levels of glucose, அதாவது gestational diabetes சொல்றாங்க இல்லையா, அது இருக்கும் போது ஆண்ட்ரோஜன் ஹார்மோன்ஸ் இன்னும் அதிகமாகி ஆஃப் ஸ்பிரிங்குக்கு, அதாவது குழந்தைக்கு PCOS வர்றதுக்கான வாய்ப்புகள் அதிகம் அப்படிங்கிறது ரிசர்ச். ஸோ we will watch a YouTube video, then you will be able to know and understand the condition better. Are you all there? யாராவது எஸ் சொல்லுங்க.
Yes, ma'am.
Yes, ma'am.
Thank you. I'm just
Ma'am.
yeah. Is the audio of the computer audible to you all? It will come now. Wait.
also called PCOS, is an imbalance of the female
Is it audible? Was it audible now?
Yes, ma'am. Yes, ma'am. It was.
sex hormones. The ovaries are part of the female reproductive system, along with the fallopian tubes, uterus, and vagina. Your ovaries contain your lifetime supply of eggs. These eggs are immature and are stored in tiny, fluid-filled structures called follicles. Your pituitary gland, located at the base of the brain, produces hormones that direct the function of your ovaries. Each month, the pituitary gland secretes follicle-stimulating hormone, or FSH, and luteinizing hormone, or LH, into the bloodstream. After these hormones reach the ovaries, several hundred immature eggs start to mature, expanding the size of the follicles. As the eggs mature, the follicles secrete estrogen, the main female sex hormone. Once the amount of estrogen in the blood reaches a certain level, the pituitary sends a surge of luteinizing hormone to the ovaries, causing the most mature follicle to open and release its egg in a process called ovulation. The free egg travels through the fallopian tube where it awaits fertilization. Eventually, the remaining immature follicles and eggs dissolve. If the egg is not fertilized, the egg and the lining of the uterus are shed during the next menstrual period. If you have polycystic ovary syndrome, your pituitary gland may release abnormally high amounts of luteinizing hormone into your bloodstream, disrupting your normal menstrual cycle. As a result, your follicles do not mature and ovulation does not occur, which can lead to infertility. Some of the immature follicles do not dissolve and remain as fluid-filled sacs or cysts. In addition, your doctor may find your blood has high levels of insulin, a hormone produced by the pancreas. Too much insulin, combined with high levels of luteinizing hormone, can lead to excess production of a male hormone called testosterone in your ovaries. Abnormally high levels of testosterone prevent ovulation, which can lead to infertility. High levels of testosterone also cause many of the physical features associated with polycystic ovary syndrome, such as acne and abnormal hair growth. Having polycystic ovary syndrome raises your risk for type 2 diabetes because of excess insulin and insulin resistance, heart disease, high blood pressure, cholesterol abnormalities in the blood, and endometrial cancer. Since there is no cure for polycystic ovary syndrome, your doctor may recommend one or more medications to treat your symptoms, such as hormonal birth control, which, while preventing pregnancy, also regulates your menstrual cycle and reduces testosterone production in your ovaries. Anti-androgen medications, which reduce abnormal hair growth and acne. Diabetes medications, such as metformin, which lowers your insulin levels and regulates your menstrual cycle. And fertility medications, which can stimulate ovulation so you can become pregnant. If you want to become pregnant and fertility medications have not succeeded in restoring ovulation, your doctor may recommend laparoscopic ovarian drilling. During the procedure, your surgeon will insert a small needle into the ovary and use an electric current to destroy small areas of ovarian tissue where testosterone is produced. Over time, testosterone production diminishes and ovulation may occur.
So, now we saw the symptoms of polycystic ovarian syndrome. We will just continue. So, enna நம்ம புரிஞ்சுக்கணும்னா, it is not only the condition or problem of the ovaries. So, pituitary gland produce hormones when they are changed due to, again, as I said, genetic factors and environmental factors. Then the ovaries do not function properly. The ovarian follicles are not released. I mean, the ovum is not released. The ovarian follicles become sacs and cyst. So PCOD and PCOS differences. PCOS is little rare. PCOD is very common. It is metabolic disorder due to hormonal imbalance. In total endocrine disorder. More cyst will be present in the PCOD because here other problems are also there. But both have genetics is the same cause. And PCOD can be reversed with medication. PCOS is usually cannot be reversed. And diet control, exercise, lifestyle changes, medication. Here diet, exercise, medication. And what they said about surgeries, no, like the drilling and all that. For PCOD, they usually do. PCOS also they do in case the patient wants to become pregnant. Hard to get pregnant, easy to get pregnant with medical aid in PCOD. PCOS, the risk of diabetes, other problems are also there. So, அவங்க சொன்ன மாதிரி என்னென்ன ப்ராப்ளம்லாம் இருக்குன்னா எக்ஸசிவ் ஹேர் growth இருக்கும். PCOD, PCOS ரெண்டுத்துலையுமே அது பேர் ஹிர்சூட்டிசம்னு சொல்லுவாங்க. தட் இஸ் டார்க் கோர்ஸ் ஹேர், மேல் பேட்டர்ன் ஹேர் வந்து நம்ம ஃபேஸ்ல எல்லா இடத்துலையுமே க்ரோ ஆகும். தின்னிங் ஆஃப் ஹேர் இந்த ஃப்ராண்டல் ரீஜன், நம்மளோட பால்ட்னஸ் மாதிரி தின்னிங் ஆஃப் ஹேர் இருக்கும். டார்க்னஸ் ஆஃப் ஸ்கின், ஆர்ம்பிட்ஸ், கிராயின்லாம் டார்க்னஸ் ஆஃப் ஸ்கின் இருக்கும். மென்ஸ்ட்ரல் irregularity இருக்கும். ஒருவேளை பீரியட்ஸ் வரும்போது ஹெவி ப்ளீடிங் இருக்கும். சிவியர் ஒபிசிட்டி வில் பி தேர். ஆக்னே வில் பி தேர், அதாவது பிம்பிள்ஸ் வில் பி தேர். PCOSக்கும் இருக்கும். இன்னும் அடிஷ்னலா வெயிட் கெயின் இருக்கும், ஹெடேக்ஸ் இருக்கும், அண்ட் தென் டிப்ரெஷன் இருக்கும். ஸோ லாட் ஆஃப் அதர் சிம்டம்ஸ் ஆர் ஆல்சோ தேர். ஸோ இதுக்கு நம்ம பார்த்த மாதிரி எக்ஸசிவ் diet is the problem, insulin resistance is the problem, being overweight is the problem, stress is a problem, query hypothyroid is also a problem, liver dysfunction is also a problem. இதெல்லாம் query போட்டிருக்காங்க, but all of this play a role. So what happens is, as we said, ஜெனட்டிக்கா அவங்களுக்கு ப்ராப்ளம் இருக்கும், ஜீன்ஸ் இருக்கும். அந்த ஜெனட்டிக் டிஸ்போசிஷனோட சேர்ந்து இம்பார்ட்டண்டா என்விரான்மெண்டல் டாக்ஸின்ஸ், அதனால ஏன்னா நம்மளோட ஃபுட்ல வர அடல்ட்ரேஷன், pesticides, all those toxins, and importantly gut dysbiosis, which we will see, because now they have identified that gut bacteria is altered in people with PCOS, and that is one important factor, especially the maternal gut health. குழந்தை வயிற்றுக்குள்ள இருக்கும்போது அம்மாவோட gut health எப்படி இருக்கோ அதை பொறுத்து தான் அந்த குழந்தைக்கு வரக்கூடிய எல்லா வியாதிகளும் உருவாகுதுங்கிறது இப்போ ரீசன்ட் ரிசர்ச். அண்ட் டயட் அண்ட் லைஃப் ஸ்டைல் இம்பார்ட்டன்ட். ஸ்ட்ரெஸ், டயட் ப்ராப்பரா இல்லாதது, இதுக்கெல்லாம் சேர்த்து இன்சுலின் ரெசிஸ்டன்ஸ் வந்துடும், ஹைப்பர் ஆண்ட்ரோஜெனிசம் வந்துடும். நம்ம ஏற்கனவே சொன்ன மாதிரி எல்லாம் சேர்ந்து PCOS வந்துடும். And is it only a 20th century phenomenon? No. ஆக்சுவலா முன்னாடிலாம் அல்ட்ராசவுண்ட் இல்ல. ஸோ பாலிசிஸ்டிக் ஓவரி சிண்ட்ரோமை கண்டுபிடிக்க முடியாம இருந்திருக்கலாங்கிறது இப்ப இருக்க இந்த பர்டிகுலர் பேப்பர் வந்து அப்படிதான் சொல்லுது. ஸோ தேர் ஹாவ் பீன் லைக் அட்டாப்சிஸ் விச் were done during the earlier centuries. அப்போ ஆல்சோ தே ஹாவ் ஃபவுண்ட் certain follicle filled or cyst filled ovaries. பட் அந்த சமயத்துல ஃபர்டிலிட்டி மட்டும் ப்ராப்ளமா இருந்திருக்கும், அவங்க பிரெக்னென்ட் ஆக முடியாம இருந்திருக்கும், அவங்களுக்கு வந்து வெயிட் கெயின் இருந்திருக்கும். பட் அது பாலிசிஸ்டிக் ஓவரி சிண்ட்ரோம்னால தான். இட்ஸ் பிகாஸ் ஆஃப் பாலிசிஸ்டிக் ஓவரி சிண்ட்ரோம் they could not diagnose. So now because we have lot of ultrasounds being done, we have lot of other tests being done, so we are able to diagnose better, and that might be one reason why polycystic ovary syndrome is on the rise. And again, having said that, now the dietary and lifestyle changes are more pushing us more towards the stressful environments, which was not present probably in the earlier centuries. So the opinion is mixed. So again, important thing is, இதெல்லாம் சொன்னாலும் chronic low grade inflammation, அதாவது உங்க உடம்பு வந்து ஒரு chronic-ஆ உங்களோட மெட்டபாலிசம், உங்களோட ஹோமியோஸ்டாசிஸ், அந்த பேலன்ஸ் போயிட்டு இந்த ப்ராப்ளத்தாலலாம் ஒரு கிரானிக் இன்ஃப்ளமேஷன் நடந்துகிட்டே இருக்கும் உடம்புல. அந்த இன்ஃப்ளமேஷனால இம்யூனிட்டி குறைஞ்சிருது, மற்ற டயட்ரி ப்ராப்ளம்ஸ் வருது, ஒபிசிட்டி வருது. நீங்க பாத்தீங்கன்னா இந்த PCOD டெவலப் ஆகிறதுக்கு முன்னாடி ஸ்லோவா உங்க உடம்புல உங்களுக்கே ஒரு சேஞ்ச் என்ன தெரியும்னா, எவ்வளோ நினைச்சாலும் வெயிட் குறையாது. எவ்வளோ நினைச்சாலும் ஒரு மாதிரி மூட் வந்து லோவாவே இருக்கும். அப்புறம் இந்த ஃபேஷியல் ஹேர்ஸ், ஹேர் தின்னிங் இதெல்லாம் உங்களையும் தாண்டி நீங்க ஸ்ட்ரெஸ்டா இருக்கீங்கன்னு கூட உங்களால தெரியாது. But the low grade inflammation will continue to persist, and all of this suddenly when you find one day you will see that when ultrasound is taken, PCOD, PCOS may be diagnosed. And as I said, ஒரு gut microbiome study பண்ணாங்க. So gut microbiome னா என்ன? யாராவது unmute பண்ணி சொல்ல முடியுமா? Can anyone unmute and tell what's the gut microbiome?
The microorganisms present in the stomach.
Yes, thank you, ma'am. Yes, they are the microorganisms. நம்ம உடம்புல different tissuesல microorganisms இருக்கும், but more so in the intestine, okay, small and large intestine, also in the stomach. These gut bacteria are unique to every individual, okay. They're very unique, and depending on what we eat, how we are, the environment, the geography, it changes. So there was one study which was published in Nature wherein they transplanted microbiome, அதாவது பாக்டீரியாவை ஒரு ஹியூமன் பாலிசிஸ்டிக் ஓவேரியன் சிண்ட்ரோம் இருக்க பேஷண்ட் கிட்ட இருந்து எடுத்து ஒரு மவுஸுக்கு அவங்க டிரான்ஸ்பிளான்ட் பண்ணாங்க. பண்ணினா அந்த மவுஸும் இன்சுலின் ரெசிஸ்டன்ஸ், அதாவது இன்சுலின் பான்கிரியாஸ் ப்ரொடியூஸ் பண்ணிட்டே இருக்கும். ஆனா அந்த இன்சுலினை செல்ஸ் எடுத்து குளுக்கோஸ் கன்வெர்ட் ஆகி செல்லுக்குள்ள போக முடியாது. ஸோ த குளுக்கோஸ் வில் ஸ்டே இன் த பிளட். அது தெரியாம பாடி இன்சுலின் தான் ப்ரொடியூஸ் ஆகல, ஃபர்தர் இன்சுலின் ப்ரொடியூஸ் ஆகும். ஸோ இட்ஸ் இன்சுலின் ரெசிஸ்டன்ட் இன்சுலினிமியான்னு சொல்லுவாங்க. That will develop, and the mouse developed polycystic ovaries, increased inflammation and infertility. So they were very sure that gut microbiome plays a major role. And other studies, நிறைய studies பண்ணதுல in the people who have PCOS, their vaginal microbiota, there was decrease in lactobacillus, chlamydia, prevotella மாதிரி நல்ல ஆர்கானிசம்ஸ் கம்மியா இருந்தது. gut microbiotaலையும் alpha diversity, beta diversity, அதாவது certain group of good bacteria, they were all decreased. So all of this was connected to the gut microbiome. So இதெல்லாம் நான் சொல்லிட்டேன். திரும்ப நம்ம என்ன ஸ்ட்ரெஸ் பண்ணிருக்கோம்னா, நீங்க ரிமெம்பர் பண்ண வேண்டியது இந்த வெபினார்ல இருந்து என்னோட பார்ட்ல 1, there will be chronic low grade inflammation, 2 metabolic problems, 3 all are linked to the gut microbiota. ஸோ இதெல்லாம் சொல்லிட்டோம், என்ன ரீசனும் சொல்லிட்டோம், ஸ்ட்ரெஸ்னால ஒரு முக்கியமான விஷயம், இன்னொன்னு வந்து டயட்னு சொல்லிட்டோம். ஸோ ஓவர் டு டாக்டர் அமுதவர்ஷினி and Mrs. Negha Bharadwaj to tell you how you can manage polycystic ovary disease or polycystic ovary syndrome. Thank you. Namaste.
Yes, thank you, Dr. Preeti, ma'am. Am I audible to everybody?
Yes, ma'am.
Yes, ma'am. So let me just share my screen.
I would request you to switch on the
Yeah,
video.
yes.
Yes.
Is my screen visible to everybody?
Yes, ma'am.
Yes, ma'am. Thank you. All right. So I'll be talking about how we can manage PCOD with the help of naturopathy. So moving on. Yeah, so this is just a normal, the causes for PCOD has been explained, very well explained by Dr. Preeti in detail. So I'll just do a little brush through as what exactly happened. So because of all the causes which ma'am had mentioned, like environmental toxins, like genetics, improper diet and lifestyle, so you have two different things happening in your body. So one is excess androgen secretion, and two is maybe because of the irregular levels of the hormones in your body, you have there's something called as abnormal clock gene expression in the ovary. That is, there is some genetic changes which happens in the ovary, in your genes or in your chromosomes, right? So this happens simultaneously. So because of the excess androgen secretion, what happens is your circadian clock gets altered. So your circadian clock is nothing but your biological clock. So this biological clock is not only responsible for your sleep and wake cycle or your hunger and appetite cycle, etc. It is also helpful for, it's also responsible for most of the biological actions that are happening in your body, out of which menstruation is also a part of it. So when there's excess androgen secretion, the circadian clock gets altered, and once this clock gets altered, there's something called as a suprachiasmatic nucleus, which is present in your brain. So that is responsible for the entire body clock. So you have a small clock and then you have a bigger clock in the body. So that bigger clock is something called as the master clock of the body. Yeah. So when this small clock is altered, it ultimately affects the bigger clock, as a result of which PCOD comes in. And here, when you look at the abnormal clock gene expression in the ovary, it affects the expression of the steroid hormone biosynthetic enzymes, right? So by steroid hormones, we mean the hormones that are responsible for your menstruation or your periods. Yes, those are called as steroid hormones. So in the hormones, synthesize pannakodia. That is, for these hormones to get metabolized, you need some enzymes in your body. So enzymes act as catalysts in metabolizing these hormones, which are present in irregular levels in your blood. So to metabolize these, you need biosynthetic enzymes. So what happens is, when there's abnormal clock gene expression, these biosynthetic enzymes go for a fall, as a result of which there's hormonal imbalance. As a result of which, when there's hormonal imbalance, you get excess androgen secretion, and the excess androgen secretion in turn leads to PCOD. So this is just a normal flowchart as to how exactly PCOD happens. So coming to naturopathy, what are the root causes of disease according to naturopathy? We believe three major causes. One is lowered vitality. By vitality, we mean the body in itself has an inherent energy to heal itself. Okay, so we call it prana, we call it chi in acupuncture, we call it prana according to yoga. So there's something in your body which is like a very powerful natural energy which tends to heal itself, which helps the body to heal itself. So it's a healing energy of the body. So when there is lowered vitality, or when the self-healing energy tends to become low, that is one major cause of disease. And then accumulation of morbid matter or toxins. So when there's unwanted substances or unwanted toxins in your body which get accumulated and which are not getting excreted or which are not getting metabolized, so that leads to something called as accumulation of morbid matter or accumulation of toxins, which ultimately leads to inflammation, or which is also called as toxemia. Okay? And next is abnormal composition of blood and lymph. So these are two major vital fluids in your body, which are, one is responsible for circulation and the other is responsible for removing the toxins, or basically just excretion. Yeah. So when there's abnormal composition of these two, there is no proper circulation and there's no proper drainage happening. So rather than excretion, I would like to present it as drainage. So lymph is responsible for drainage and blood is responsible for circulation. So when there's abnormal composition of these two important vital fluids in your body, again, there's an increased chance of you to get a particular disease. So that is what is mentioned here also. So if you see at this chart here, so the first line says disrupted circadian rhythms, which we discussed in the last slide, improper lifestyle and stress. So all these are interlinked with each other. Okay. So all these three give rise to all the three root causes of disease according to naturopathy, namely toxemia, or that is nothing but accumulation of morbid matter, and then comes abnormal composition of blood and lymph, and then lowered vitality. Again, all these three are interlinked to each other. Okay, so in this first step, when you identify that you're very stressed, or when you identify that your lifestyle is not okay, that you have a sedentary lifestyle and my diet habit is not that holistic, I do not have a very well balanced diet, and also you by disrupted circadian rhythms, you get signs. You have interrupted sleep, you have very frequent hunger, or you have very low satiety. That is, even though you eat well, you're not able to feel full. Yeah, and you get all these irregular cravings, etc. So all these indicate that you have disrupted circadian rhythm, improper lifestyle and stress. So when you identify that you are in the first line itself, we will do something called as prevention in naturopathy that will prevent you from moving into the root cause of disease according to naturopathy. So that can actually prevent you from going to lowered vitality. But if you are unable to identify that we are having the first line in us and we move to the second line, and then ultimately the lowered vitality moves into something called as metabolic syndrome. Abnormal composition of blood and limbs leads to something called as endocrinal dysfunction. That is, the endocrines are where your hormones get secreted. Yeah, so that leads to a dysfunction. And by toxemia, there's going to be inflammation. And when there's inflammation, there's going to be ovarian morphological stages. By morphology, we mean structural changes. Yes, the morphology is structure. So ovarian morphological changes happens when there's toxemia, endocrine dysfunction happens when there's no proper blood and lymph, and metabolic syndrome happens when there's lowered vitality. So any one of these three is prone to cause PCOD or PCOS. So when we move into the state of metabolic syndrome or endocrine dysfunction or ovarian morphological changes, we give something called as curative care. Okay, so we have two different types of care. We have prevention, which is given in the first step. And then even if you're unable to identify in the prevention stage, then we'll give something called as the curative care. So this is just a rough flow chart as to how exactly we approach our disease according to naturopathy. Okay. So moving on to the branches of treatment in naturopathy, all of us mostly know. So diet and lifestyle, yoga, hydrotherapy, aromatherapy, massage, acupuncture, and acupressure. So out of all this, the last point, the massage, acupuncture, and acupressure, you will definitely need the help of a physician to instill the treatment in you, because you will not be able to do it by yourself. And the others also, even though it can be practiced at home by your own self, I would recommend you to please consult a naturopathic practitioner before starting any kind of treatment, because every body is different. So every body reacts to different forms of treatment in different ways. So whatever suits your body, you will have to check with your practitioner, and then you can go ahead with practicing that form of treatment. So moving on to the basic diet aspect of the treatment according to naturopathy for PCOD. So the first, we call it therapeutic fasting. Again, therapeutic fasting under the supervision or under the guidance of a practitioner. There have been many researches that say that therapeutic fasting has helped not only PCOD and PCOS, but various other disorders also. Yeah, so it can be a 21-day fast, or it can be intermittent fasting, or it can be a mono diet, or you have different forms of fasting. So whichever form of fasting will suit your body definitely will help in improving any particular condition which is present in your body. Why? Because as Preeti ma'am had discussed, your gut is your major area for your health. Okay, so, and fortunately or unfortunately, the gut and the gut system is the major working system of the body, because we keep eating something. So even when we are sleeping, the gut does not sleep, because it tends to digest whatever we ate for dinner. Okay, so it is a longer working system than the other systems of the body, right? So when you go into fasting, what happens is you put that particular major system of your body into a state of rest, because through fasting, you just take very, very gut to actually re-energize and revitalize itself. So as your gut comes to a state of rest, that becomes very easy for your body to recover and repair itself. And then low glycemic index diet. By low glycemic index, we mean like, when you eat food, and by the time the food metabolizes, the end product of any carbohydrate-rich food will be glucose. All right. So by low glycemic diet, we mean, like, say, for example, once that particular food is metabolized, the amount of glucose molecules present in the blood after the metabolization is called as glycemic index, to put it in layman terms. Okay. So we have to choose our foods accordingly, which have low glycemic index, in the sense when that particular food gets metabolized, it produces less number of glucose molecules in the blood. Vegetables and legumes, they bring out very less number of glucose molecules in your blood rather than the other, like, normal rice or wheat rich food, etc. Okay, and then anti-inflammatory foods. Anti-inflammatory foods, why? Because in case if you have a toxemia in your body, or if there's a lot of accumulation of unwanted matter or morbid matter in your body, we will have to reduce that inflammation. We'll have to detoxify ourselves. So where these anti-inflammatory foods come into play. So like turmeric, ginger, leafy greens, and all kinds of berries you can have as anti-inflammatory foods. And then we have something called as hormone regulating food. So hormone regulating food, in a sense, so whenever we have this PCOD or PCOS, we generally tend to have an hormonal imbalance, be it your progesterone levels, be it your estrogen levels, be it your androgen levels. So whatever it is, there's always some imbalance which is going on. Okay, so to regulate this imbalance, we have some hormone regulating foods which have the tendency to regulate our hormones, like cruciferous vegetables like broccoli, cauliflower. You have the entire cruciferous family, which are hormone regulating. You have flax seeds and sesame seeds. Yeah, so sesame seeds, in fact, they mimic estrogen. Okay, so when you have them raw, they tend to mimic inside your body that it's estrogen coming inside. Okay, so like that, you have different hormone regulating foods. For whatever particular hormone dominance you have foods according to that. And given in the right side of the screen is examples of probiotic and prebiotic foods, which are very responsible for maintaining a gut microbiome. The gut microbiome was discussed by Dr. Preeti. So these are some Indian foods which can actually help in the proper balance of the gut microbiome. So we have probiotic and prebiotic. Probiotic are foods which have the bacteria in them or which have the good bacteria in them. And the prebiotic foods are foods which that are for the bacteria. That is, that help the bacteria to strengthen themselves and grow further. Okay. So make sure that your every meal has proper probiotic and proper prebiotic foods. So you can just note out the examples of probiotic. You have idli, buttermilk, dosa, paneer, etc. And prebiotic, you have apples, radish, cabbage, garlic, onion, etc. Yeah. So this is just half of the diet. Moving on. Yes. So moving on, next is healthy fats. Why healthy fats is because you need omega-3 for proper hormonal functioning. So omega-3 fatty acids are very much present in healthy fats like avocados, nuts, and seeds. Okay. The oils which we're using, they may say that they're omega rich, etc. But the credibility or the organic form of omega-3 is present in healthy fats like avocados, nuts, and seeds. All right. And then herbal supplements. So maybe what and all herbs can be taken for PCOD? If you ask me, we can actually go in for ashwagandha, shatavari, triphala, fenugreek, spearmint tea, and cinnamon. Okay. So this ashwagandha is readily available in the form of powders in the market. You can mix it with honey and you can have it as a semi-solid paste. Shatavari is also a powder. Triphala is also a powder. Fenugreek, you do have powders, or you can also soak it overnight and you can have it raw. And then spearmint is more like peppermint, but a variation of peppermint. Okay, that in the form of tea you can have. And cinnamon is very, very good because it has a component called as cinnamaldehyde. Yeah, so which also helps in regulation of your progesterone and estrogen levels. That is your hormone regulating level. So you can have cinnamon in the form of powders or in the form of tea. You can have it in like that. And then hydration and detox. So hydration and detox, not only for PCOD, but for your general health is very, very important. So drink plenty of water because the higher the water content in your body, the higher the flushing out of toxins happens. So higher detoxification happens when there's proper hydration. And natural detox juices like aloe vera, amla, ashgard, all that you can consume early in the morning on empty stomach, so that they act as natural detoxifying agents. They bring out all the toxins from your body, reducing your inflammation and also thereby reducing your toxemia. Gut health, which we already discussed, because they help to reduce inflammation and also they improve hormonal balance. Because your gut-brain axis is there, that is directly linked to the pituitary gland. So that is where your hormones start secreting, which we saw in the video last. So it is very important in maintaining a very good gut health for improving your hormonal balance. And reducing processed foods. Why should we reduce sugar, refined carbs, and processed snacks? Is because of something called as insulin resistance. I think that was discussed by Dr. Preeti also. So when there's prolonged insulin resistance in your body, there tends to be a constant raise of cortisol, which is nothing but your stress hormone. So you put into constant stress when there is insulin resistance, knowingly or unknowingly, your body is under stress and you're not even able to identify it. Okay, and that is because of the processed foods which you're having. That is because of the high sugar content and high carbohydrate content which the processed foods tend to have. So because of the insulin resistance, because of the increased cortisol levels in your body, there's going to be hormonal changes, there's going to be toxemia, and then ultimately it's going to lead to several disorders like metabolic disorders, out of which PCOD is also one. So please try and reduce your processed foods. Okay. So this is what I've been mentioning. So ginger here has gingerol in it. So again, anti-inflammatory property, reducing toxemia. Cinnamon was also already discussed. Fennel seeds, they mimic estrogen. Again, you can have them. And this is badam and coconut. Okay, so you can always have them because nuts, not only they are good fats, but they also have a good amount of potassium and magnesium in them. So a good amount of potassium and magnesium in anything will also help in hormonal balance. There is a research which says loss of potassium and magnesium from your body can also lead to hormonal imbalances. So make sure that you have sufficient potassium and magnesium. And yeah, sesame seeds was already discussed. Citrus fruits. Citrus fruits, why? Because again, anti-inflammatory properties reduces toxemia. And then there's something called as seed cycling. So not only for PCOD, but for your general menstrual health in general, like if you have severe dysmenorrhea, that is painful periods, or if you have very low bleeding, or if you have very high bleeding, etc. So you can always follow seed cycling for hormonal regulation, for regulating a menstrual cycle, and for your overall health also. So your cycle, let's say it's divided into 28 days. So day 1 to day 14 will be one phase, and day 14 to day 28 will be one phase. And you have 4 seeds. You have flax seeds and pumpkin seeds, and then you have sesame seeds and sunflower seeds. So 4 seeds. seeds. So day 1 to day 14, you will have to take 1 tablespoon of flax seeds and pumpkin seeds each. And day 14 to day 28, that will be your sesame seeds and sunflower seeds. So day 1 to day 14, that is just when you're about to ovulate. That is from when you start bleeding until when you ovulate, you need to have pumpkin seeds and flax seeds. And after ovulation, till your next menstrual cycle, till the day you start bleeding next, you're supposed to have sesame seeds and sunflower seeds. So this is what is seed cycling. It's a very proven method for hormonal regulation. Again, tender coconut water, again, very much rich in potassium and magnesium, the two major things which are very responsible for hormonal balance in your body. Ashgat juice, as I was already mentioning, for detoxification, you can just drink it in the form of juice early in the morning on empty stomach. Green leafy vegetables, again, the same like tender coconut water, rich in potassium and magnesium, definitely needed for the body for proper menstruation. Again, whole fruits and vegetables is also already discussed, and reducing your processed food, sugar, and snacks. Yeah. Moving on to what and all lifestyle changes we will have to do. So regular physical activity for at least 30 minutes a day. It can be aerobic exercises, it can be yoga, it can be walking, whatever you prefer, it has to be done. But yoga is a holistic form of healing, like it's a holistic form of exercise. So I would always prefer if you can do yoga for at least 30 to 60 minutes a day. Yeah. And then managing stress via meditation, yoga, or aromatherapy. Your stress needs to be managed. At the end of the day, you should feel calm and comfortable, and you should just let go of whatever is happening around you. So that can be managed very well through meditation, through yoga, or through aromatherapy. And proper sleep hygiene, 8 hours or 7 to 8 hours of proper sleep, proper good sleep. By good sleep, I mean nothing which is interruptive or nothing which is very disturbed. You go to your bed, and then on the next 15 to 30 minutes, you go to sleep. And then the next thing you remember is waking up in the morning only. There's nothing which happens in the between. So there's good sleep. So proper good sleep is very, very restorative, not only for your internal organs functioning, but also for your hormone regulation. And sun exposure for at least 10 minutes per day. Why sun exposure? Is because sun is the major source of vitamin D. Vitamin D, unfortunately, even though if we take supplements, even though if we take diet or something, we cannot compare it with the amount of vitamin D we get directly from the sun when we expose ourselves to it. Okay, so that's nowhere compared, because sun's levels of vitamin D exposure is too high. So maybe within the first 1 hour of sunrise, you can just go and expose yourself to the sun for 20 minutes, 25 minutes, wear a very light clothing, or 1 hour before sunset, or in between if you want to expose yourself. It will not be that much effective, but but at least you can. But majorly try to choose between the morning 1 hour or the last 1 hour before the sunset. So try and expose yourselves to the sun for at least 20. I have put 10 here, but I would say 20 minutes so that you get the proper amount of vitamin D in your body. And vitamin D helps not only in it helps in regulating a circadian rhythm. It helps in hormonal regulation, and it also helps to balance your mood. So if you're very angry, if you're very frustrated, you frequently have mood swings, that indicates that your vitamin D levels are a little low. So kindly expose yourself to sun for getting the organic vitamin D from nature. And these are a list of yoga asanas which actually help in PCOD and PCOS. So they basically target your pelvic area and your lower back strengthening areas. So when we strengthen your pelvic area and your lower back areas, they tend to improve the uterine health, as a result of which PCOD and PCOS conditions are also improved. When yoga is also done along with breathing, so you focus on your breathing, your concentration is completely on the stretch of your body with that of the breathing. So that tends to give a very holistic approach to your entire body. And you're not only doing any physical activity, you're also doing activity for your mind and your soul. Yeah. So these are some asanas, and we also have Kapalbhati, Nadi Shuddhi, and Brahmari. These are very 3 pranayams which tend to balance your stress. They tend to help in hormone regulation, and they also are very beneficial in PCOD, specifically the Kapalbhati pranayam, because it involves the movement of the abdomen in a fast manner. So that tend to stimulate the hormones in the abdominal area, that tends to stimulate the organs in the abdominal area, toning them. Yeah, so these are a general list of yoga asanas and pranayam which you can do if you have PCOD or PCOS. Moving on to hydrotherapy and mud therapy. Okay, so hydrotherapy is therapeutic aspects of using water for a particular kind of disease, and mud therapy is where we use mud for treating a particular disease. So by hydrotherapy, we have sitz bath, food bath, steam bath, hip bath, cold compress, and contrast hydrotherapy. So by sitz bath, I mean you can see a tub here in the slide. I've put a picture. So this is a hip bath tub. So the sitz bath tub is something a little shorter than this tub, where only your anal area and your vaginal area will get immersed into the tub. So it will be a very tiny tub, only those two areas will get immersed in it. So when you take a cold sitz bath, what happens is it tends to tone that particular vaginal or your anal area. And also, so when it's your vagina, when it's concerned with your vagina, your pelvic area is also immersed into it. So as a result of which, your pelvic area, which is responsible for your menstruation, also gets toned. By toned, I mean strengthened. Okay. Next is food bath. Why food bath is because major of your nerve endings end in your food. Okay, so even when you're stressed at the end of the day, if you're not having sleep, and if for whatever condition it is, a food bath is always advised because major of your nerve endings tend to come and end under your feet only. So when you immerse that particular feet into a temperature of water, that gives immense therapeutic effects. Steam bath is basically when you sweat everything out, all your toxins come out. Hip bath, majorly like sitz bath only, has the same benefits. Cold compress is where you place like an ice pack or something on your abdominal region. Again, anything which is cold tends to strengthen your body or tends to tone that particular area, as a result of which everything gets strengthened. Contrast hydrotherapy, by contrast hydrotherapy, I mean mixing of hot and cold. So this is given when there is pain in a particular condition and also you want to tone it. Like say, for example, I'm just giving a general example. So if I have generalized body pain, so what I'll have to do is I'll have to start with hot for like 3 to 4 minutes, and then I'll shift my shower to cold. I'll do cold for 30 to 40 seconds, and then again hot, and then again cold. By this, what happens is my muscles which are paining, that hot will help in elevating the pain. That is, the pain will reduce, and the cold will actually help to strengthen my body muscles. Okay, so that is the point in it. So here for PCOD, if you ask me, they will advise you for a hot and cold hip bath or a hot and cold sitz bath. Okay, so or even a hot and cold compress, but that is not very frequent. So a hot and cold hip bath will be the most perfect method of treatment for PCOD or PCOS for hydrotherapy in general. Yeah. Coming to mud therapy, like mud pack to abdomen is a very good form of treatment for PCOD or PCOS, where there's mud mixed with a little of water, and it's just put into a wet cloth, I mean just a normal cloth, and it is placed on your abdomen. Yeah, so that gives a very much cooling effect, and mud is proven to remove the toxins in that particular area, thereby reducing inflammation inside if there's anything. And yeah, and as this cooling effect, everything gets to get restored. If there's excess body heat which is causing hormonal imbalance or something, once your body cools down, there's going to be proper hormonal regulation. So mud therapy is an excellent cooling technique, and it's an excellent toxin removing technique. Moving on to aromatherapy, that is therapeutic use of smells. So you have essential oils available in the market like clary sage, lavender, rosemary, peppermint, tea tree, and yang yang. So these are 6 oils which are very beneficial for PCOD and PCOS, not only for the hormonal regulation, but also for for improving your mood, for improving general pain, analgesic effect, we call it, like, pain relieving effect, because in PCOD, because of the cysts, some women, they do tend to have lots of pain in the in the lower abdomen, all over your legs, etc. So this using of aromatherapy helps in hormonal regulation and also for pain relieving. So the aromatherapy techniques are diffusion, massage, bath, and inhalation. You can use any one of these. In diffusion, you just need to add 2 to 3 drops of aroma oil. Just use it as a room freshener. By massage, you'll have to dilute it with a carrier oil, and then you'll have to apply on the skin or the affected area wherever pain is there. And then you can add 2 to 3 drops of essential oils onto the bathing water which you're using. And then inhalation, you can just put it in a napkin or a tissue, or you can just keep smelling it 2 to 3 times in a day or something like that, whenever you find it needful. And moving on to the last thing, massage, acupuncture, and acupressure. Again, this has to be given by a practitioner, so I have not put in much details of it. But the major benefits of these 3 in common is, one is hormonal regulation, detoxification, improved circulation, and reduced stress. All the 4 of which are very primary or very much necessary things to help us recover or help us improve from whatever condition of PCOD or PCOS we have. Yeah, so with this, I end with my talk. So thank you all for listening. Over to Neha ma'am for psychological aspects. Thank you all.
Thank you, Amuda ma'am. Thank you, Preeti ma'am, for explaining about PCOD and what natural remedies we can do, what naturally we can do. Thank you so much for that. So we come to the last part of today's webinar, that is how stress, how psychology affects your PCOD. So before I go into the details, can you quickly put in the chat box how many of you feel that, yes, mind has a very important role in having or not having PCOD? You can put your answer as yes or no in the chat box. Okay, thank you. Yes, yes, yes. Okay, I have received 3 yes or 4 yes. Very good. Super. So you all feel, thank you, many yeses, I can see that. So you all feel that mind does play an important role. So what, according to you, is the reason in the mind front or the psychological front that may be a reason for PCOD or PCOS? What will be the reason that causes PCOD or PCOS psychologically? Okay, so someone has put us stress. Thank you, Dr. Preeti. Do you all agree? Is stress a reason for PCOS or PCOD coming into us? I mean, yes, lifestyle stress. Yes, okay. So tell me one thing, how can mind cause something that is genetics, can influence something that is physical? Yes, food habit too. Thank you, Jeevita ji. Lifestyle and food habit too. So what is the relation between this? That is what we are going to see in today's webinar, the last part. That is, just a minute, I'll just share my screen. That is, mind your PCOS or PCOD. So let's talk about that. So we all have stress, right? So how does stress affect us? Let us look into that. So stress actually, so if you all had looked into what Dr. Preeti had shown a video, if you had seen that, then you would see that it was explained what is a pituitary gland. And it releases hormones which affects different parts, especially your adrenal gland. You all know we have kidneys on the side back, on both the sides, we all have kidneys, right? On the top of the kidneys, we have something called as adrenal gland. And this adrenal gland secretes something very important called as cortisol. Okay, this cortisol and this adrenaline are actually good hormones. Okay, what do you do when you see a snake? Suppose you're walking down an alley, okay, you're walking down a dark road, okay, and all of a sudden you see something crawling in front of you. What do? You see something crawling, something snake-like thing crawling. Jump, okay. Only jump. You'll only be there and jump, scared, okay. Afraid, okay. But what will you do? Run. Yes, thank you so much. You will not just jump, you will just start running, right? Ayyo, pambu, right? How do you run so fast? I mean, in the Mari, PT Usha on the title, we can easily make her look like no one. We'll run that fast. How are we able to run that fast? It is because of adrenaline gland and cortisol gland. Immediately, these two glands will be secreted from the adrenal gland above the kidneys, and it will give us so much energy that will start running. Okay, so this is actually a very safe and protective hormone. Both these are actually safe and protective hormone. But imagine what will happen if we always have chronic stress. Do you know what is chronic stress? Can anyone tell me what is chronic stress? Yes, Suganti ma'am, you're right. Adrenaline is what makes us run so fast. Thank you. Does anyone know what is chronic? What do you mean by the term chronic? long term. Thank you, Dr. Preeti. So stress for a very, very long time. If it is there, then adrenaline and cortisol will be continuously secreted in our body, which will lead to all of these things happening, especially this glycogen to glucose conversion. We run, right? After seeing a snake, we run. To get that energy, immediately the liver, which stores glycogen, it is the storehouse of our body. It has the energy. It will convert glycogen into glucose, which will be secreted in our blood, and we'll get all the energy. But if we are continuously under stress, the adrenaline and cortisol hormones will continuously convert our glycogen and glucose. It will keep on sending insulin and telling, convert glycogen to glucose, convert glycogen to glucose, convert glycogen to glucose. Okay, so in such a case, what happens is two things will happen. When we, I'll before I come to this, whenever we are stressed, what are the two things we normally do? Whenever we are very stressed, romba stress irukku, bahut stress hai yaar. What are the two things that we normally do? What are your two reactions when you're very anxious, very stressed? Something related to food. Cry or eat well. Thank you, Jeevita ma'am. Yes, especially related to food. Either we starve ourselves or we eat a lot, excess eating or binge eating, right? So what happens when we eat a lot? Insulin resistance develops. Now what I explained to you is called as insulin resistance. This happens when we have chronic stress. Chronic stress leads us to keep on converting glycogen into glucose. At the same time, we are also stressed, so we eat a lot, which leads to insulin resistance, and hence we gain a lot of weight. Preeti ma'am and Amuda ma'am were saying, right? We gain weight. This is the psychological reason for gaining weight, which in turn leads to PCOD, which in turn leads to anxiety and depression. Again, anxiety and depression will lead to chronic stress. Again, chronic stress will lead to binge eating and glycogen converting into glucose, that is insulin resistance, weight gain, PCOD, anxiety, depression, and the cycle will go on, and we are stuck in this cycle. So I have a few questions before I go to the next part. So everyone who is fat, they'll get PCOD. Is it true or false? You can type in the chat box. Everyone who is fat will have PCOD. True or false? False. Thank you. No, false. Very, very good. I really have a very good audience today. Superb. Okay. And everyone who has stress will have PCOD. True or false? Thank you. Yes, Aruna Devi ma'am, may or may not. You are actually on point. True. Okay. Everyone who has stress will have PCOD. So we have received one answer as true. So like Aruna ma'am said, being fat or having stress may or may not give us PCOD. Stressnala or chronic stressnala PCOD aarthukku vaayippundu. That is, we have a chance of getting PCOD. It increases, ma'am said, no, genes or study pannirukanga. It is found that stress goes and affects our genetic replication. Appoda we start getting all these problems. So it affects our genes. Stress affects our genes. So the chances of getting PCOD increases if we have stress. Okay. So now what can we do? So what we are going to do is we are going to work on this stress. PCOD irka illiya. It is always good to work on stress, right? It is always good to work on chronic stress. Am I correct? So let us, when we get a chance to work on stress, why not work on stress? So let us work on our stress. Okay. So there is stress, for everyone, stress is different. Okay. That is why if you have a long-term chronic stress, it is advised that you go in for a psychotherapy or a counseling. But whatever I'm going to share today is just it's not tailor-made, it's just a general idea. So you can apply it in your house, in your daily life, even if you have normal stress or chronic stress. But if you can, do take the help of a psychologist if you have long-term stress and you are not able to control your stress. So there is one mantra called as the 4 A's of chronic stress. Okay, and that mantra, the 4A mantra is avoid the stressor, alter the stressor, adapt to the stressor, and accept the stressor. Stressor na enna? What is stressor? Can anyone tell me what is the stressor? Ma'am, stressor nu solreenga. Endathu ma'am in the stressor. You can also unmute yourself and say, or you can put in the chat box. Something that causes stress. Thank you so much. Problem maker, very true. Thing that makes us stress. Very, very right. Reason for stress. All of you are correct. Stressor is what causes us the stress. Okay, so let us do a quick activity. All of you just grab the nearest pen or pencil, pen with a page. That is, if you have a pen with a page, diary, book, notebook, pencil, one thing to write on and one thing to write with. Can you quickly get it? And once you get it, can you put yes in the chat box so that we can move ahead? Okay, so we have got 1 yes, 2 yes. Okay, quick. Can we quickly grab a pen and a paper? Yes. Superb. Good, there's a thumbs up. Well done, well done. So tell the others you are getting your book, pen and paper or thing like your pen and paper. Those who have got, can you write one major stressor in your life currently? It can be unable to manage your work-life balance. It can be something related to your finances. It can be something I'm not able to, like, I'm planning to buy a house, but I'm not getting a loan. Or it can be something like my children are studying in 11th and 12th, 10th and 12th, and they have their board exams coming up, which is causing me to get to have lots of stress. It's making me anxious. So it can be anything. Can you write down one reason that is causing you stress? One stressor. Once you write, just put a thumbs up in the chat box. Okay, yes, I can see a few people have written it. Good. Okay, others, are you writing it? I have received only 2 people who have said yes, we have written it. Anything, it can be a small thing, it can be a big thing. I'm not asking you to write something like a chronic stressor. It can also be a small stressor, or it can be something related to your health. Okay, I'm receiving a few thumbs ups. Very good. Very good. Okay. So now that you have written and others are thinking what to write, okay, I want you to draw below that 4 quadrants. Number maths la draw pannuvolia 4 quadrants like that. Like this, draw 4 quadrants. Okay, draw 4 quadrants. And now we are going to discuss in each of this quadrant what all we can do to avoid the stressor. Whichever is applicable to you, you write only that. Okay, so let us go to the next slide. I'll take one example. For example, if someone has written, I find it difficult to manage my work-life balance. That is, office work I'm finding it very difficult. Okay, so if that is the case, how can or what all things can we do? So first is avoid the stressor. How can we avoid the stressor? Can it be possible that we tell a no? How many of you find it difficult to tell a no? Really? Me, okay. You are not able to tell a no. யாராவது ஏதானு கேட்டாங்கன்னா okay, 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 yes, 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 இதோ பண்றேன், I'm coming. You are not able to say no. Okay. So those who have put as me and those who have not put, but உங்களுக்கு தெரியாது, you have identified yourself as you are someone who cannot say a no. Yes, someone has raised their hand as well. Please learn to say a no if possible. எல்லா situationலயும் சொல்ல வேண்டாம், but at least in certain situations you are going to take rest. You have been cooking throughout the day, okay, and you go and sit and someone who is sitting next to you tells you கொஞ்சம் அந்த கண்ணாடி எடுத்துன்னு வந்து தாங்க, கொஞ்சம் அந்த பேப்பரோ புக்கோ எடுத்துன்னு வந்து தாங்க. You need not get up and go. You can say, can I do it after 10 minutes? You are not saying a straight no. You are just saying that I want to rest, so I'll do it later. So if they are in urgent, அவங்களுக்கு அர்ஜென்ட்டா அது வேணும்னா அவங்க போய் எடுத்துக்கலாம். You are given some work in the office and you are already handling 4 or 5 things, juggling between those 4 or 5 things. You can say, okay, your idea is definitely, sir, thank you so much, sir or ma'am, thank you so much for placing so much confidence on me. But currently I am handling these 5 things. Can I take up that work once I finish this? Or once I finish one of these things. So if they are in some urgent thing, then they will give it to someone else, appoint someone else to do that work. But if that work is important to you, you take it up. If you feel no, it is not that important, learn to tell her. And avoid people who stress you, not situations. Don't avoid going to a social function just because someone stresses you. Avoid that person in the function. And the auntie or uncle, avoid them. But don't avoid the function. Why should you avoid the function? You enjoy the function, you go. That auntie or uncle, if they come, no, just run away from that place. Okay. Put down a list of what all work you have, what all things you do, your to-do list, or what all things you are doing, and from that prioritize எது பண்ணணும் எது பண்ண வேண்டாம். Okay, which is important, which you need to do, it is urgent, or you cannot avoid it. அந்த மாதிரி things put it, the other things strike it down or put it down. அப்புறமாவும் பண்ண முடியும், we can do it later. Okay, so out in the first quadrant, in the kurta naal, the 4 that we have given here, you can pick and choose the ones that you can apply, okay, to your given situation. Now coming to the second one, alter the stressor. என்னால மாற முடியல, நான் ஸ்ட்ரெஸரை மாத்திடு. I cannot change, I'll change the stressor. Okay, so how can you change a stressor? Talk it out to someone. How does talking help? Can anyone tell me? Even you can unmute yourself and tell, how does talking to someone helps altering the stressor or helps avoiding stress or decreasing stress? You can put it up in the chat box.
If you tell to some,
yes, ma'am, please.
If you tell to something, share, which means it will relax our mind. It
Exactly.
may give some solution or not, but our mind will become relaxed.
Exactly. Right. We went out. Once we went out, whether it gives a solution or not, at least someone is there to listen to me. No, yaro enna kettundrukangalla. That feeling comes in. Very true. That is the first thing. And also, sometimes when you are talking to someone, I don't know how many of you have felt it. Sometimes when we are talking to someone, we ourselves find solution to the problem. பேசிட்டே இருக்கறச்ச ஆமால நான் இப்படி கூட பண்ணலாம்ல அப்படின்னு நம்மளுக்கே ஒரு டியூப்லைட் எரியும். Right? Yes, ma'am, Ovia ma'am. They may not know our pain, but at least they listen to us sometimes. Very true. So that also happens to us. So when you express it to someone, you may or may not find a solution, but you went it out and you feel good. அது நெஞ்சிலேந்து ஒரு பாரம் எடுத்த மாதிரி இருக்கு. Sometimes while telling it to others, we ourselves find solution, or sometimes, like Ovia ma'am said, they give us a different opinion. நம்ம வந்து அது தப்புன்னு நினைச்சுட்டு இருப்போம். ஆனா அவங்க வந்து அதுக்கு ஒரு டிஃப்ரெண்ட் பாயிண்ட் ஆஃப் வியூ கொடுக்கறச்சா ஆமால இப்படி கூட நம்ம யோசிக்கலாமேங்கிற ஒரு தாட் வரும். Right? And be willing to compromise. How many of you have heard the story. I don't know the story in India. So in a jungle, there was a river that was flowing just in between the jungle, and it was dividing the jungle into two parts. Okay, so there was only one thin wooden, I would not say wooden, a tree trunk that was connecting these two parts of the jungle. So every day the animals, if they had to go from one side to other, they had to cross over this tree trunk to go to the other side. So one day it so happened that two wild boars came on that trunk. So one boar came from one side and the other boar came from the other side, and they both came in the middle of the trunk. And one, say, suppose boar A said to boar B that go back, I want to cross the river. Boar B said, no, you go back. Why should I? You go back. And then you go. In between that, they both started fighting and both of them fell down the trunk into the river. Okay. Now next, two rabbits they came. Now one rabbit came from one side, the other rabbit came from on other side. They both looked at each other, and first they said, why don't you move back? I want to go to the other side. The other one said, I'm also in a bit of urgency. Why don't you move back? So in all of that, they both came with the solution that, okay, fine, let's do one thing. I'll go down, you go above me, so that you also walk, I also walk. So that way they crossed the bridge. How many of you have heard this story? This is a story which has been told to us since we were in lower classes. Have you heard this story? Yes, right? So compromise. நம்ம ஏன் குனியணும்? நான் ஏன் எதிராளி எதிர்க்க குனியணும்? Why should I say a yes? This is one thing which is always there in our mind. But sometimes compromising actually gives a solution to our problem. சரி, விட்டுடலாம், அவங்களே ஜெயிச்ச மாதிரி இருக்கட்டும். அதனால if we are able to focus better on our work, why not? Be willing to compromise and be assertive. Like I said, you can say no by not directly saying, இல்ல, என்னால பண்ண முடியாது. அந்த மாதிரி சொல்ற இடத்துல, no, I cannot do it, I'm very busy. Can't you see? Like that, instead of saying so, you can always say it out, voice it out in a very assertive manner, right? And reassess your expectations. நம்ம என்ன expectation வச்சுட்டு இருக்கோமோ, is it realistic? Many times we expect from the other person that இந்த மாதிரி behave பண்ணக்கூடாது, they should do their work faster. But is that possible? Can you really go and change them? If they are not related to you, you cannot even tell them. So in the மாதிரி the expectations, are they realistic? Are they workable? Check out. Okay, so alter the stressor level, which all are is something that you can apply. Write those points down in your paper that you have. Next is adapt to the stressor. So try to reframe the problem and look at the bigger picture. Siri, if that problem is there, okay, and still I'm not facing that much problem. Like எனக்கு சாப்பாடு இருக்கு, எனக்கு துணி இருக்கு, போட்டுக்கிறதுக்கு துணி இருக்கு, சாப்பிட சாப்பாடு இருக்கு, இருக்க வீடு இருக்கு, and still I'm able to smile. So maybe that problem is something that is not affecting me that much. Sometimes when we look at the bigger picture, ஒரு problem வந்து ரொம்ப சின்னதா தெரியும். இல்ல sometimes we look at only the problem. We keep on focusing only at the problem that miss out on the very good things that are near us. Right? And sometimes every day if you are going through the same route, okay, and there is a pothole in that road that you are going, and every day when you go you have to take in a bump. So every day you will be like, that is a small minute stress that is there, right? So rather than that, exercise பண்றதுக்கு வருது பாரு, நம்ம jumping jack வருது, நம்ம ரோடோட jumping jack வருது. If you can reframe the problem, the way you look at it, the perspective, the perception, that changes, and adjust your standards. If you have too lofty standards, it's not wrong, but it should not be stressful for you. பக்கத்தாத்துல வந்து they have a Mercedes Benz. I also want a Mercedes Benz. Is that the necessity? Or you are happy when you have an i10 or an i20 car? If it is serving your purpose, then why do you need a Mercedes Benz? Adjust your standards. So adapt to the stressor level, which is workable for your stressor. Write down those. And finally, accept the stressor. If you cannot control the stressor, if you try to control the stressor and if it is giving you stress, leave it. Let it. Like I told, you cannot change certain people. So don't go into trying to change them. We ourselves don't change for others. You change for others. Right? So try not to control things that are uncontrollable. மழை பெய்யுறது மழை பெய்யுறது இப்ப துணியெல்லாம் காயாது இப்ப நான் என்ன பண்றது because of this rain all this dresses all these clothes are not getting dried up. Rather than taking it as a stress, can you control the rain? Can you control the climate? No. So either accept it, say வீட்டுக்குள்ள we will have to inside the house we'll have to tie a few the rods or some strings and put the clothes on that, some ropes and put the clothes on that. Don't try to control the climate. Try to control how you can solve the problem. And look for the upside. Seri, mala peyyarda, good. At least I can have a hot cup of tea. Mala peyyarda, okay, fine. That's a good thing. In konjo climate cooler, in Chennai, we so much expect for that climate to be so cool, no? So we should actually sometimes be happy for the rains, right? And learn to forgive. As easy as this is said, it is the toughest thing to do. We are not able to forgive people that easily. We don't forgive our own selves. How many years we hold the grudge? So forgiving is actually not for that person. Forgiving is for us. If we don't forgive that person, we are holding on to that grudge that is causing us stress and we are having all these problems. Okay, so learn to forgive. So under accept the stressor, what all are applicable for you, you write it down. And when you have this whole page ready, after the webinar, think about it and start acting on it. And if you still have that problem, we are always there to help you. Okay. Now let us go to the second problem related to PCOD. Simple ways to binge eat. Avoid binge eating. To work on your binge eating. Okay. I'll give you 4 very simple steps. Okay. First is replace the behavior. Amudha ma'am kuda sonnangala junk saapradinganu. So whenever we have that, all of us have that craving, no? Even I have that craving, I need that junk and those snacks vanda saapad nongro or aasa irukradhu suda samosa bhaji the saapidumbodhu we feel so happy. We want to eat that, no? Till a time when we are sitting we feel like we imagine those things and we want to eat it, right? So when you have these feelings, replace it. Walk out, listen to music or exercise. So replace the behavior. And we cannot always avoid it. Sometimes we have a very high craving. So those times use a technique called as small portions. Small portions, chinna plate liyo, chinna cup liyo, the saaparicha, especially the sweet and all, you feel like you have taken periya plate la the chinna piece vekkarichu, you feel like you evlo kammiya saaptirupom. Yeah. But when we keep it in a small plate and it looks big, it is like we are tricking our mind. Piece and eat slowly. That is why if you go to foreign countries, when you have a sweet, a dessert, they'll give you a small spoon. They'll not give you a big spoon. So you actually are tricking your mind by eating more bites. It is the same size. Okay, so try this technique. Small plate, small cup, small spoon. So you relish it more, you enjoy it more. So you focus on the quality and not on the quantity. And avoid the black or white mindset. So nariya time, I don't know how many of you have felt this, but it happens with me. Sometimes we eat, we get, in small portions, you also get those small chips packets, small snacks packet. Buy that rather than buying the bigger packets. Okay. So that being said, coming to the black or white mindset, okay, tell me how many of you, it happens with me. Sometimes when I open that packet and I have 3-4 chips, and I'm like, Neha, 11 o'clock, you're having chips. Now you will not feel hungry at 12 o'clock to eat your lunch. So let's finish this off. We'll have our lunch later. 3 o'clock, 4 o'clock, we'll have our lunch. And we end up eating the whole packet. How many of you have had this experience? We eat a small part and then we tell ourselves, we take ourselves for a guilt ride, and then we say, "Chha, I'm in a panto, so let us finish off the whole packet." Has any of you experienced it? If yes or no, if you can put it, it would be great. Yes, someone has put a yes. Okay. It happens with me all the time. Like many a times it happens with me. So I end up finishing the whole thing. So there was this another one technique that was mentioned, which said that, okay, if I eat one, that doesn't mean I have failed. Fine, I can close the packet, keep it. Instead of eating at 12 o'clock, I can eat at 12:30 rather than making it 3 o'clock. That thought changes our perception. And that way we can avoid the black and white mindset. And the main and important question is, when you feel hungry, is it really a physical hunger or a psychological need? Do you want comfort? Do you want to talk out to someone? Do you want to cry out to someone? Do you want someone just to listen to you, to hold your hand and say that is okay? Are you actually looking for a way to cope? So, what are you hungry for? Okay, that is something that we have to think when we have this binge eating. Binge eating is one of the main reasons for PCOD, but many of us, even if we don't have PCOD, we have the habit of having we binge eat a lot. We binge eat our snacks and everything. And now I'll share a small what do you say? I'll share a small video with you. It's one of my favorite Tamil songs. So if you know the song, I would really be very happy if you can sing it along. Okay? I'll just share it. Give me a second. Okay. So how many of you have heard this song? Just a minute, it's buffering. Is the audio, are you able to listen to the audio? Is the
No, ma'am, you have to, while screen sharing, you have to go to the advanced option and share computer audio, ma'am.
sorry, ma'am, just a minute. Advanced option. Will it be there in the
Yes, in that green share button, no? When you click it,
yeah,
documents advanced on the top, right?
yeah.
In that advanced, and go to computer audio. And click
Okay, just a minute. I'll just do that.
and then share again, ma'am. That
Okay, ma'am, I am not getting that option.
Okay, you share the link. I'll just share it for them.
Maybe I'm not, because I'm not a co-host, maybe.
Oh, okay. Wait, what? Yes.
Yeah, I am a co-host. I'm not able to do
You
it.
give me the song. I will just.
Yes, ma'am, please, just a sec.
You sent me, ma'am? Yes.
Ma'am, I have shared the song with you. If you can just
You've shared
play
a
from.
form. You have shared a form.
Oh, sorry. Am I? Have I?
Yeah.
No. Oh,
Share
just a
the.
minute.
Yes, sir.
Yes, ma'am, I have. So if you can just play from 1 minute 15 seconds.
Yes, I'll do that.
So by the till the time ma'am shares that video with all of you. So can you all tell me actually which aspect of psychology are we trying to work when we are discussing all these things? What part of our brain are we trying to work? I'll share something with you here. Okay, I think Preeti ma'am is sharing.
Is the song audible?
No, ma'am. Your screen is not in share, like you're not sharing your screen, ma'am. It's not. Now it's not audible, ma'am. It's okay, ma'am. No problem. Okay, all of you, can you just guess from the thing which song is this? If you can guess it, this is a very famous song in Tamil Nadu and with the Tamil population. Can you guess which song is this? You can put it up in the chat box or even
I'll just
unmute yourself.
play the audio for them. Let them listen to the audio in the.
Yes, ma'am. Yes, I'll share it with them, ma'am. Yes, can anyone guess which song is this?
வாழ நினைத்தால் வாழலாம் சார்.
Yes, thank you, ma'am. Exactly. In that song, there is one very beautiful line. If you can listen to it from 1 minute 13 seconds, it says that பார்க்க தெரிந்தால் பாதை தெரியும், பாதை தெரிந்தால் பயணம் தொடரும், பயணம் தொடர்ந்தால் கதவு திறக்கும், கதவு திறந்தால் that is when she says that if you know to see, you can see the road. If you see the road, you are able to walk. When you are able to walk, you are able to open new avenues. When you are able to open up new avenues, you are able to see hope, get hope. And when you have hope, you feel like living. That is what she says in this song. And that is so true. So what aspect of, when you listen to this song, please do listen. I have shared it in the chat box. Whenever you get time, please listen to this song. Okay. So which aspect of our life are we working on when we say Paaka Terindal? That is Paaka Terinja, if you can see. Are we working on our thoughts? Are we working on our feelings? Or are we working on our behavior? What do you think? Which aspect of our life are we working on? You can put it up in the chat. Sorry?
Feelings, ma'am.
You're closer, ma'am. It is actually difficult to work directly on feelings. So we usually work on the, yes, someone has put us thoughts. Thank you, Suganti, ma'am. We are working on the thoughts. Whatever we did till now, all these things, right from avoiding the stressor, learning to tell a no, is indirectly we are trying to change our thinking pattern, to change our perception. So what we are actually doing is working on our thoughts, which in turn works on our feelings and thus on our behavior, which again works on our thoughts. And vice versa is also possible. Thoughts which work on behavior, behavior working on feelings, and feelings working on thoughts. Okay. And now I'll come to the last part of today's webinar. Okay. This is a challenge. So I want you all to take out your mobile. And if you're listening this, that is you're attending your Zoom through mobile, you can also minimize it. And I want you to take up a 5-day challenge. It is called as Mind Body Check-in Challenge. Okay. In a day, 3 times you have to set alarm. So if you have your mobile, please for 5 days, next 5 days, set up an event in your calendar, or even for tomorrow, you can set up alarm. Or for the next 5 days, you can set up alarm 3 times a day. It can preferably be 10 o'clock in the morning, 3 o'clock in the afternoon, and around 7 or 8 o'clock in the evening. Okay, 3 times you set up the alarm. Whenever the alarm rings, think about 3 things. How am I feeling emotionally now? Am I angry? Am I happy? Am I satisfied? Am I irritated? Am I sad? How am I? How am I feeling right now? How does my body feel right now? Am I feeling tired? Am I feeling energetic? Am I having body pain? Am I feeling lethargic? And should I work on it? Should I live with it? Or should I leave it? What should I do? Think about it and find a solution 3 times a day. These 3 questions, 2 questions and 1 solution you have to work on. And after working on it for 5 days, I'll share our number with you. Please do let us know how did you feel. Here is our number. Okay, so you can either put it in the medical guidance number or the psychological counseling number or the naturopathy number. Do give us a feedback. So basically what we are doing is we are just taking up a challenge so that we are aware about ourselves, mindful about ourselves. That are we stressed? If we are stressed, are we working on it? How to work on it? So we are actually self-regulating ourselves, self-regulating our stress, and thus avoiding many problems, including PCOD. Okay, so you have our number with us. So kindly let us know the feedback. Try it for 5 days. Okay, so with this, we stop our webinar for here. Thank you so much for attending it, and thank you for your patient listening. Preeti ma'am, over to you, ma'am.
Thank you so much, Neha ma'am. Thank you so much, Amuda ma'am. If any participant has any queries or any suggestions or any comments, we are welcome to share so. And we have also shared a link to our feedback form. We request you all to kindly fill in the feedback form, which will enable us improve or work upon certain aspects which would be more useful for the audience. And our medical guidance, mind care, and naturopathy numbers we have shared in the chat box. The medical guidance is free of cost. We provide medical guidance on different aspects. And mind care psychological counseling, it is free for all students and those who cannot afford. And for those who can afford, it comes at a per session fee of 300 rupees. Naturopathy consultations are free. Naturopathy treatments are very affordable. That is being provided by Dr. Amuda in our clinic at Gopalapuram. And there are yoga sessions happening across the DAV branches in Gopalapuram, Mogapir, and online. And per month, the yoga fee is 200 rupees per month. We request you all to join the online yoga at least and try having the benefits. You can contact the naturopathy yoga number and Dr. Amuda ma'am will be able to guide you further. Thank you all. If there are no questions, we will see you again in the next webinar. Thank you so much for your patient listening. Namaste all.